Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about childhood asthma, eating disorders, and cystic fibrosis. All of that coming up next on Community Health Matters. Channel 5 Network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everybody. Asthma in children is a leading cause of visits to the emergency room, hospitalizations, and a lot of missed school days. But if people really get a hold of it and take care of these kids with good treatment and prevention, they can prevent damage to those growing lungs. My first guest, Dr. John Robertson with TriStar, is here to talk about a very, very prevalent illness in our kids. Welcome.
Thank you. Thank you for having me.
Sure thing. Let's talk about how widespread childhood asthma, cases of childhood asthma are in this country.
It's very widespread. It's the #1 chronic disease of childhood. About 1 in 13 children have asthma, depending on the year you quote.
So millions of children in this country.
But a little over 6 million children in this country that have asthma.
Let's talk about what happens in the kids' bodies, in their lungs, and what triggers so many cases of asthma. I know there are various triggers.
Yes, so asthma is a problem of the airways, or the tubes in the lungs that conduct air from the outside world into our bodies. The problem with these tubes is they get inflamed, they get swollen, they produce extra mucus that shouldn't be there, and the muscles that wrap around these air tubes constrict. All of these things sort of conspire to basically shrink these air tubes and make them smaller and therefore harder to breathe. That's what generates the symptoms of coughing and wheezing and chest tightness that are most prevalent.
You just answered my next question about some of the symptoms. When do you typically see these symptoms in kids? I mean, does it start when they're babies or usually a little older?
It can start when they're babies, usually by the age of 5. Most people with asthma have had their first set of symptoms, but it can start at any age.
Is it usually seen in the parents? You see it run in families or not necessarily?
It definitely runs in families. It doesn't have to. There is a group of diseases we call atopic or allergic diseases. This includes hay fever and allergic rhinitis and eczema, as well as food allergies. Sometimes it's another member of this allergic family that runs in the family, whereas the mother may have eczema and the baby or young child develops asthma.
So is that something that as a pediatrician, you know, that you are looking for, if you know that about the parent, one of the parents, that you're looking for that early on?
Yes, absolutely. We want to acquire a family history, and see what else see what other allergic problems are within the family, so that we know what the child is at risk for.
Identify early on. That was one of my questions. So the risk factors, let's talk about what some of the risk factors are. So that if you do have a parent with some issues, that's one of the risk factors? Absolutely.
The risk factors, you can divide them into 2 categories. The risk factors you can control and the ones that you can't. The ones that you can control, the most important is smoking. Don't smoke. When a pregnant mother smokes, or when a child is exposed to smoke in their home environment, even if the parent is smoking outside, it increases their risk of wheezing and the risk of having asthma.
I see a lot of the other risk factors for developing childhood asthma also includes, again, family history of allergies and or asthma, prenatal and postnatal exposure to tobacco smoke, you just alluded to, living in an urban area with increased levels of air pollution as we grow so quickly in Nashville. That's got to be a side effect of the growth, right?
The unintended consequence of progress, yes. So there's the hygiene hypothesis of asthma. There's higher incidence in children born and who grow in urban areas versus the out in the country. There's no one factor. It's just the groups of things you're exposed to in the country versus the groups of things you're exposed to in the city. Some would say we're too clean as far as germs go in the city. But there's increase of irritants and toxins like smog and smoke and ozone.
Let's go back to the symptoms again, too. I know you mentioned wheezing. I believe you said chest tightness is one of the symptoms, too.
Yes, the coughing and wheezing are the most common. The chest tightness, just feeling of difficulty breathing. Sometimes it's just being tired with exercise. An important thing to note about the symptoms is they're different for every patient. Some patients only cough, some patients only wheeze, but they can both have asthma that responds the same to the asthma controller medication.
All right, and it can be a whistling sound too.
I can imitate it if you like, but the wheezing is like 1,000 faraway whistles. And the cough can be, it's classically a dry cough, but can also be a wet productive cough.
So what complications can arise as a result of asthma?
In a child, we think about school absences, and therefore, if your kid's home, you're home. Generally, they don't get, when their asthma is very active, they don't get to be normal, happy kids. They don't get to run and play like everyone else. They start off fine, but after 5 minutes, they're struggling and having to rest or complaining to their parents they're tired. And so a warning sign I usually give to my parents is if you see your child, they can't keep up with their peers and they're 4. You know, we don't have star athletes at 4 years old. Everyone should be basically equal. So if there's a child lagging behind, we want to look for a medical reason that they're having to rest twice as often as their peers.
And you hate to see that. You know, that's got to affect the kid emotionally, the child emotionally as well, too, if they can't keep up.
Absolutely. One of the measures of how well controlled or how uncontrolled is my asthma is, does the kid get to be a kid?
Sure.
Or does their life look the same or different from their peers? In 2018, the medications we have for asthma are extremely effective. And so when used properly, I would say 95% of the time we can take that child who untreated can't participate normally in in kids' life, and turn it around and make it basically help them be a normal kid.
Okay, in our last 30 seconds here, ways to help prevent attacks.
Take your medicine. The right medicine used in the right way, given at the right time, will help prevent attacks. There are 2 categories of asthma medicine: quick relief, which the albuterol is the most common one, and the controller medications. People who use their controller medications are less likely to have attacks.
All right. Really solid information as we get back to the school year, too. You said when you tend to see more attacks also because of viruses as the year progresses with school and everything. All right. Thank you so much, Dr. Robertson. Appreciate you coming in and educating us more about childhood asthma. Thank you. And we'll be back with a whole lot more right after this.